let's look at the format now of your session. A HEPA session. What's that? A HEPA session is a health enhancing physical activity session for older people. The most important thing to remember when designing and delivering a program for older people is that it is health enhancing. To make sure that it is improving their health as much as possible, be sure to adapt and modify your class or your program to suit the needs of everyone in your session, regardless of their disabilities. Remember what I said in the last session, think of what you can do, not of what you can't. So, your session format or a HEPA session should include icebreakers, warm-up, your main activity, warm down, I never say cool down because it sounds too cold, warm down, and a wee chat. Icebreakers are fun and always and a great way to get our attention. It might be something as simple as all those who are wearing blue change places. It involves all the class and more importantly it gets your class to move. It also brings the shyer people at the back into a different position. And this can be done even if people are sitting. And I'll deal with the chair-bound class in a little more detail later on in the session. Okay, warming up. The aim of the warm-up is to prepare various body parts for more strenuous activity. Following a visual and variable screen at the start of the class, begin warming up. This applies regardless of what activity is following. Your warm-up then should be maybe no longer than 20 minutes. Certainly shouldn't be less than 20 minutes, Use music 120 beats per minute, and there's two parts to the warm-up. There's the joint mobilizers and what we call pulse raisers. Music is, in my opinion, essential to any class in terms of enjoyment, keeping the beat, memory aids, etc. The only thing to worry about is if it's too fast or too slow. Generally speaking, 110 to 120 is good for getting the circulation going. Again, the warm-up should be longer than you would use for a younger group. Be sure to warm up all the joints first before going into bigger movements, or what I call, if it said, the pulse raisers. Remember the analogy I used earlier. Cold joints are like crystallized honey. You need to get them like runny honey. Bigger movements, example, swimming, raising the arms up above the head, they will get you going and get the circulation going. So the joints. Move all your joints through their full range of motion. Move your fingers and toes. Squeezing and releasing is a good way of doing that. And repeat the moves about 3 times. No more. Make sure they're warmed up. And if a joint is inflamed, a hot joint, do not mobilize. Joints must be lubricated properly to make sure that the muscles and ligaments around the joints are warmed and loosened. Pay particular attention to the thumb. If you lose the ability to use your thumb, ADLs, activities of daily living, are compromised. So your warm-up continued. Your pulse raisers. Use more dynamic moves. Moves to raise your heart rate, your pulse. Moves to raise your breathing. Moves to raise your body temperature. When used in sequence, all these moves will make a participant warmer, but not hot. Breathe a little deeper, but not be out of breath. And maybe the heart rate beat a little bit faster. Explain to your class that they should feel their heart beating a little bit more. And as I said before, it should bump but not thump. You should be huffed but not out of puff. And you should glow but not flow. So your activity session then. The most significant change that any adult can make is increasing the regularity and frequency of physical activity. If you make the session safe and enjoyable, you and the participants will have more success. Pause now for a task. I want you to fill in the blanks. Activities that involve blank muscle groups and blank movements such as dancing and cycling are termed blank. Okay, I'm sure you've got all these blanks, but I'll read them out. Activities that involve large muscle groups and repetitive movements, such as dancing and cycling, are termed aerobic. And the music tempo should be from 120 to 140 beats per minute. But I'm sure you got all those. Normally you would do something aerobic in your session, even if that's just increasing your pulse and breathing activities in your warm-up, especially if the session is sitting only. About music, any tempo over 140 beats should be used in a very controlled manner. The faster the movement, the smaller range of motion, decreasing the actual work that the muscle is doing and increasing the risk of injury. So, muscle balance. There are muscles that need strengthening and there are muscles that need stretching, because postural alignment is very important. Posture checks are probably the most important thing you're going to do. Do them at the beginning of the class and throughout the session, even at warm-up. Let's look at the muscles I'm talking about very briefly. Muscles that need strengthening and stretching, there is a whole lot of them, and too much to go through, but to achieve proper posture, there is attention need to be paid to these muscles. They have different requirements depending on what you wish to achieve. And again, there are just too many to go through. So suffice to say that some muscles need strengthening and some muscles need stretching at one time or other during your session. By the way, if you are guiding someone through a particular exercise for a particular body part, try not to use any of the above names, like quadriceps or iliopsoas or pectoris or trapezius. Use front of arm, back of arm, etc., as most older people don't know what you're talking about. Now, improving strength. Improve your strength by using all the major muscle groups, using muscles against the resistance or extra weight, own body, and using repetitive body weight movements, example like resistant bands, and of course in the gym, weight machines. But you must try and include strength and balance, and it isn't difficult. Strengthening exercises like climbing the stairs or a machine or lifting and carrying or gym home-based exercises, they're all strength exercises. Use slightly more resistance than you would normally use. And remember what I said before, the body doesn't know if it's in the gym or if it's just moving and climbing and going up and down the stairs, doing its ADLs. Session delivery continued. Improve balance by moving about in different directions, exercise to movement, music classes, whatever. Try three-dimensional movements, example, racket sports, walking on uneven ground. And again, music tempo appropriate for movement control should be about 90 to 120 beats per minute. With balance training, the object really is to try and achieve a movement which takes the body mass off centre safely. Like, as I said before, standing on one leg or up on the tiptoes and reducing the amount of upper body support. Music needs to be slow enough to allow participants to control their movements. That's the important thing about the music. The postural balance components would be the vestibular, that's the inner ear. Vision, you could test that with your eyes closed, swaying from side to side, and somatosensory. We constantly gather information about our surroundings. The slope on a hill, the slippiness of a surface, the force of the wind through our eyes, our muscles, and special canals in our ears. The proprioceptives are nerve endings. That would be the somatosensory, and they would be like touching the surface with your hands to feel your way, maybe in the dark. That's what we're talking about. So good balance then involves the eyes, the ears, the brain, the nerves, the muscles, and the limbs. In fact, all of our senses and muscles are involved. the whole body. And that is why we must be aware of the age-related decline in our senses and try to compensate by doing balance and postural training. I know I keep on about it, but it is most important. So, the warm or cool down. The aim of the warm down is to assist the participant to relax physically and mentally. And this warm down should include movements done at a slower pace and stretching. Relaxing music is a bonus. So use music then for your warm down of 80 beats per minute, less. Have it at least 20 minutes. 2 parts, stretching and relaxation. And this is where chairs are a bonus again, as well as music. But even if you're standing, stretching should be performed and some form of relaxation included. And older people don't like getting down on the ground. So stretching for older people is better performed when warm, which is why it is included at the end of the session rather than at the start. And the problem with stretching at the start of the class is not being properly warmed up, and you might be, but the participant may not be. So that is why I would always keep stretching till the warm down. So again, when talking about the delivery of the session, the guidelines for conducting a safe exercise session are screen, verbal and visual. That's at the beginning of the session. Adapt to suit individual needs. Observe, look out for the signals. Modify when required. Give rests. And be careful of technique, yours as well as theirs. Screen the client at the start of the class, asking the questions as to their general health since the last session. That's verbal. For example, if they're on antibiotics, they should be at home. They have an infection, they shouldn't be at an exercise class. Use visual cues to check as well. Keep an eye on exercise ability and adapt to suit individual needs. Things change, that's what I was talking about. Get plenty of rests, get water, sit down, etc. Use the time to change the music for them to rest. Give them a reason as to why they are doing things as well. Example, moving around to stop blood pooling. If you say it helps not to get varicose veins, it makes more sense to an older person. Be careful of your own technique and don't show off, as it is very off-putting, and be aware that if you scratch something, they will do likewise. They'll follow what you're doing, so take care on that one. Use all your experience to elicit safe exercise technique in the older people, visual, verbal and kinesthetic. I'm going to ask another question. Name at least 4 phases to include in a safe exercise session for independent older adults. Now, structure of a session, as I said, should include a warm-up, an activity phase, a warm-down, water and rest breaks, socializers at the beginning or the end, and a chat. The first 3 phases you would do normally anyway, but the socializers and the chat are so important to older people. They should be included, and as I mentioned earlier, they are not hard to do. The water and the rest breaks are normal with most workouts for the general population, but are more important with this population. Now I'm going to move on to the frailer, older category of aging. Before I do that, I just want to talk about those in transition. Those who have physical function is declining due to low levels of activity. They may not be entirely frail. I'm going to give you an example, hip replacement. So we covered a lot in our last session regarding chronic diseases. I just need to mention hip replacements here. It's not a disease, obviously, but someone who's had a hip replacement would have low levels of activity prior to the operation and would be considered in transition, or could be considered in transition rather than frail. So exercise after hip replacement. Most post-operative exercise candidates can safely perform gentle, conditioning and limbering movements which do not involve strain or call for excessive use of range. Many thousands of hip replacements are performed worldwide every year. It would be quite unusual to not have at least one hip replacement person in your class nowadays. So this is why I'm putting it in here. So guidelines for safe exercises after hip replacement. Slow controlled movement. Avoid immoderate bending downward. No exercise which requires the leg to cross the midline, as in grapevine. Hip and knee flexion should be limited to 45-degree angle. Fall prevention exercises are essential to the safety, and avoid accidental injury secondary to the falls. After medical clearance is obtained, weight-bearing activity should be introduced. This is where a chair comes in handy. Stretch and strengthening exercises can be done using the back of the chair for support, or failing that, the wall or a ballet bar if you happen to have one. Immoderate bending should be avoided as it puts too much pressure on the hip joint. Now, what I'm talking about bending downward, that would be bending down maybe while sitting, say, stretching to touch your toes. Absolutely not. So, frailer older people, those who are frail or have very low physical or cognitive function. This could be the result of chronic disease such as arthritis, dementia, Parkinson's, or just very old. This group may require a therapeutic approach, example, a particular program like falls prevention, and many will be in residential care. Earlier on we talked about the frail older person, and I said I'd get back to it, so I'm getting back to it now. We talked a lot about the age-related decline in function in older people in the last session, and we covered the implications, guidelines on various diseases. Please study all of that carefully before you decide to take on this particular category of age. That being said, there should be no good reason to avoid working with this particular participants. They're not eggshells, and they're not going to break if you do things safely. The term frailty has no precise definition, and it is characterized by a reduced capacity to cope with stressors, a lack of resilience or fragility, and a vulnerability. The detrimental effect of years of deconditioning is especially evident in this age group, and leads to spiraling losses of functional ability and independence. Frailty is marked by a loss of aerobic power, balance, strength, bone density, cognitive changes, reduction in functional mobility, and a loss of independence. Chronic disuse is believed to accelerate the loss of the above functions, leading to decreased independence. All the research on aging suggests that physical activity can offset the physiological losses in these functions, that are normally associated with aging. So it's a really good, it's really good to know that physical activity can actually do something, no matter how old you are. And I want to just look at the FIT principle on frail older adults. A minimum of 3 times a week to ensure there's some improvement in their function. Sufficient intensity to challenge the individual without, of course, being unduly strenuous. And structured exercise session, it shouldn't really be any more than an hour, but 45 minutes is probably enough. And the activity selected should be specific to the desired goal. Now, 3 times rising to 5 times a week would be an optimal thing, obviously. In addition, moving in some way, reaching, bending, walking every day should be considered to maintain function. So that's the frequency. Intensity, if it's too mild, that might mean that there's no real benefit to keeping the function. You need enough intensity to address the simplest elements of mobility and have a bit left over for the emergencies. Example, getting up after a fall, that would be an emergency. The time, well, it's dependent on the group. If they are independent, up to an hour. If they are dependent, In care settings, 20 to 30 minutes might be enough, and possibly even just doing the warm up and warm down. And try to relate back to the principle of specificity. What are you trying to achieve in your session? It might be just a bit of fun and enjoyment for them, and that's fine. So let's look at sitting down and exercise. Sit down and exercise. What I say is the most effective exercise program is the one they will do. Yes, for the frail or older person, and even for the less frail, having a chair available is essential. Often gyms don't consider this as a viable option or a possibility, and therefore they alienate a whole section of the population. So, successful communication with a group of older people depends hugely on their hearing and vision. And sitting and standing in a circle ensures good communication. Having chairs available allows rest periods between activities. Everything you need to do in a session can be done in and around a chair. For example, standing behind the chair, holding the back of the chair, going up and down on your toes. All stretches are actually better performed on chairs, and it keeps them safe. And make sure the chair, of course, is in good condition. And when sitting, keep an eye on their posture. So I'm going to just talk about a few communication skills. I put it down as you see all and all see you. You should take up a position where everyone can see you. In a seated circle is good, or standing in a circle, but seated is good, with no distractions behind you. Say it, sign it, show it. Use verbal and visual clues with clear, appropriate demonstrations. And kiss. Keep it short and simple. Keep instructions concise, simple language, and avoid jargon. Sitting down is an aid to good communication, and it is a safe way to exercise as the weight is evenly distributed. And above all, it provides rests and breaks. So I'm going to look at wheelchair and chair bound, slightly different from the independent older person who wants to sit down. But for those older adults who are restricted to a wheelchair, functional mobility is still very important. And for those older adults who are chair bound, transfers, that is, the ability to move from one surface to another, should be encouraged, because you want to maximize the highest level of independence possible. If you're wheelchair bound, you still need to be able to move independently and not rely on somebody to be pushing you. So upper body strength and mobility is very important. When we talk about transfers, this may require them to stand for a short period before sitting down again or getting into a new position. Discourage an inappropriate reliance on grab bars, arms of chairs. Obviously, if they need them, they'll use them, but try and maximize independence. So some guidelines for the chair bound. Posture promoting exercises are very important. Proper positioning of the trunk is vital. Sit up tall and straight, and you can use a lumbar roll for your back to make sure that you will sit up. Increase weight bearing and weight shifting exercises, as alternating your shift of weight from buttock to buttock. Encourage the use of all limbs where possible. That could be throwing, catching, kicking a ball, and that uses the upper and the lower limbs. While sitting, participants tend to slouch, which defeats the purpose of most of the exercises. In addition to all other guidelines for working with older adults, be sure to include weight-bearing exercises, even something as simple as lifting one buttock and then another. And try to use all the limbs if possible after a thorough warm-up, of course. Now, I want to talk about stroke. It's the first time I've mentioned it here. And the reason being, if you're doing exercises in a care setting, you will most certainly definitely come across a stroke victim. So study as much as you can regarding doing activities for this group. But remember, one class does not suit all. So you must liaison with the physio and occupational therapist to individualize the programs. Don't be afraid to ask questions, particularly if you're not a medic. So I'm going to read out stroke After physiotherapy, then what? Physical activity leader should involve the whole healthcare team. You should ask questions, and the questions to ask are, what are the short and long-term goals for this person? Which activities would be the most beneficial? Are there any activities that the person should not be allowed to perform? And is the person allowed to ambulate or walk around with supervision or without supervision? Now, there's another task coming up. What is the most important component that ensures ability to perform activities of daily living and remain independent? Is it A, weight shifting, B, dancing, C, functional mobility, or D, reading? Well, of course, C, functional mobility. If you don't use it, you lose it. If you don't have functional mobility, you'll not be able to do any ADLs. Even if you are chair-bound, you'll still want to remain as independent as possible as long as you live. So chair aerobics then. What I say is, everything that is done standing up can be done sitting down. So why stand? Older exercises like to sit down if necessary. It is less intimidating if you start in a chair, do your warm-up, get up, move around and sit down again for the warm down. Of course, it's not always possible to have chairs available, which is a pity, as it makes it more user-friendly. If you find yourself using chairs as in a care setting, there are a few points though to consider. The setup: the chairs should be in a semicircle or a circle formation, as I said before, in communication skills. In a seated position, you see all see you. The chairs should be arm distance from each other. The seat back should be flat, and the bottom of the chair should be flat. No arms if possible, not always possible in a care setting. And steps or benches or a telephone book or something like that for those of short stature to place under their feet. And don't forget the posture check. Finally, there are a few safety issues that need to be discussed. And we're talking about safety now. Instructors should be prepared for potential emergencies when working with older adults. Recognise the signs and the symptoms of distress. Take action and stop exercising. Call for medical services if required, and of course be certified of first aid, manual handling, all of that, which you would be normally anyway. But remember, not all situations are life-threatening, but it is important to be aware of some of the common problems that might occur while exercising with this group of adults. So let's look at the signs first. We've discussed some of these symptoms in our earlier session when talking about the age-related diseases, and the key to safety is to stop exercising. So if you notice any of these signs and symptoms, do get help. So stop exercising if the participant experiences chest pain, lightheadedness, confusion, pallor, nausea, sharp leg pain or shortness of breath. And your checklist then would be the temperature of the room, not too hot, not too cold, water available, check the footwear, leg care, just to be checking about varicose veins, and equipment. Just want to talk about those a little bit more. A few extra things. Older adults can only tolerate small changes of internal temperature, hence profuse sweating or perspiring. Also, if it is too cold, they won't warm up properly. So hydration is so important to prevent fatigue, and proper shoes, especially for diabetes sufferers, because they could get infections, so it's really important. When I was talking about leg care, there's a lot of ulcerated legs, or varicose veins can and do burst, and they bleed profusely. So first aid needs to be administered and dressings put on very quickly. Equipment then must be clean and in good condition and handled very carefully, because skin breakdown is unfortunately a frequent problem with frail older people, and is especially prevalent in care settings. Even accidentally touching a person has happened with me, and I hadn't got too sharp fingernails, but it caused someone's skin to break, and it's very distressing for you and for them, obviously. So, however, if you take all of the sessions seriously and try to incorporate all the recommendations, you most definitely will get more older people more active more often.